You just felt it. That specific feeling when something is wrong inside your body. Maybe it started this morning. A tightness in your throat. A heaviness behind your eyes. Your body sending a signal you cannot ignore. You know exactly what to do. You know what to search for, what to take, who to call. Now imagine that feeling, exactly that feeling. The same body sending the same signals, but you're standing in a world with no doctors, no medicine, no hospitals, no concept of bacteria or viruses or infection. No idea what is actually happening inside you. Just your body. And whatever you can figure out. That is what being sick meant for almost all of human history. And what ancient humans did about it will surprise you, because some of it actually worked. Let's start with what ancient humans understood almost immediately. Plants. The connection between certain plants and certain physical effects is not a discovery that required science. It required observation. Eat this plant. Feel better. Eat that plant. Feel worse. Try this plant on the wound. The wound heals faster. Try that plant. The wound gets infected. This was not guesswork. This was empirical knowledge built over thousands of generations. Passed down through oral tradition with the same seriousness we pass down engineering knowledge today. The evidence goes back further than you might expect. Neanderthals were using medicinal plants. At a cave called El Cedrón in Spain, researchers analyzed the fossilized dental plaque of a Neanderthal woman who had lived approximately 50,000 years ago. They found chemical compounds from yarrow and chamomile, both bitter plants with no nutritional value. The only reason she would have consumed them is for their medicinal properties. More remarkable still, she had a tooth abscess, a painful dental infection, and her plaque also contained DNA from poplar, a tree that contains salicylic acid. The same compound that modern chemistry eventually refined into aspirin. She was self-medicating. 50,000 years ago. This is not coincidence. This is knowledge. The same cave contained another individual whose plaque showed evidence of poplar consumption alongside a natural form of penicillin, the mold that Alexander Fleming would spend the rest of his scientific career trying to understand. This Neanderthal was somehow using it 60,000 years before Fleming was born. Now, here is the thing that gets overlooked every time this evidence comes up. These were not accidents. These plants are bitter. They taste bad. Nobody eats them by accident. These were deliberate choices made by individuals who understood, from their own experience or from knowledge passed to them, that these specific plants had specific effects. That is a medical tradition. In a species we used to call primitive. When researchers found Ötzi the Iceman, a man who died in the Alps about 5,000 years ago and was preserved in ice for all that time, they found something remarkable inside his clothing. He was carrying a medicine kit, not labeled, not in a bag with a red cross on it, but deliberate, purposeful. A selection of materials chosen specifically because of their medicinal properties. He was carrying birch polypore mushrooms, a fungus with documented antibacterial and antiparasitic properties. He also had an intestinal parasite, which the researchers noted may be why he was carrying it. He had dried sloe berries, high in vitamin C, anti-inflammatory, antimicrobial. He had tinder fungus, which can be used as a wound dressing, absorbing blood and potentially reducing infection. And there was one more thing. Ötzi had tattoos, over 60 of them, not decorative tattoos. They were simple lines and crosses, placed in clusters over specific locations on his body. When researchers mapped those tattoo locations, they found something striking. They correspond almost precisely to acupuncture points used in traditional Chinese medicine to treat the exact conditions Ötzi's body showed evidence of suffering from: joint pain, arthritis, intestinal problems, acupuncture-like treatment, in the Italian Alps, 5,000 years ago, before there was any known contact between Alpine Europe and China. Ancient humans were not guessing. They were practicing medicine, without having any of the theory we assume is necessary to practice medicine. Now let's talk about something more dramatic. A 31,000-year-old skeleton was found in a cave in Borneo. A young person, probably in their late teens or early 20s. Their left leg was missing below the knee. It had been amputated, not by an accident, not by an animal attack, deliberately, surgically. The bone showed careful, clean cuts consistent with intentional removal. And then, the most important detail: the bone had healed. New bone had grown over the wound. This person had survived the amputation and lived for at least 6 to 9 more years afterward. This was surgery. Deliberate, planned surgery. In a tropical jungle environment where infection would be almost inevitable without some understanding of wound care and antisepsis. The researchers who published this discovery in 2022 described it as the oldest known surgical amputation in the world, pushing the history of surgery back by more than 20,000 years. Think about what this required: knowledge of anatomy, skill with cutting tools, control of bleeding, a method of cleaning and protecting the wound from infection, almost certainly plant-based antiseptics, and ongoing care for a recovering patient in an environment with no sterile conditions. Somewhere in the forests of Borneo, 31,000 years ago, someone performed surgery, and their patient walked on a stump for 6 to 9 years. But the most astonishing surgical evidence does not come from Borneo. It comes from skulls across the world, in France, in Peru, in Russia, in China, in Israel, in North America, in almost every region where archaeologists have looked carefully enough. They keep finding the same thing: ancient human skulls with deliberate holes cut into them. This is called trepanation, and it is the oldest documented surgical procedure in human history. Here is what makes it remarkable. The holes are not random. They are carefully made, scraped, drilled, or cut with precision. The edges show signs of bone regeneration. New bone growing over the margins of the hole. That means the patient survived. Survived for months or even years after the procedure. When scientists first began finding these skulls in the 19th century, they were confused. The survival rates from trepanation performed in modern European hospitals at that time were terrible, barely 10%. Hospital infections killed most patients. So how were prehistoric people achieving survival rates of 50 to 90% with stone tools and no antibiotics? The answer appears to be that they were better at it. They had developed antiseptic wound treatments from plant compounds that actually prevented infection. They understood, through observation rather than germ theory, what made wounds go bad and what kept them clean. They worked outside without the hospital-acquired bacterial contamination that was killing 19th-century surgical patients in their sterile-seeming wards. They were performing brain surgery with survival rates that modern surgeons in the 1800s could not match. Let that land for a moment. Now, why were they drilling into people's skulls? The honest answer is, we are not entirely sure. The evidence suggests multiple reasons. For head injuries, there is a clear, practical logic. A blow to the skull can cause bleeding beneath the bone that creates pressure on the brain. This pressure causes severe symptoms and can be fatal. Removing a section of skull to release that pressure is not mystical. It is mechanical problem solving. But there are also cases where the trepanation was performed with no obvious head injury. Some researchers believe these were attempts to treat severe headaches, epilepsy, or other neurological symptoms. The supernatural explanation, releasing evil spirits trapped inside the skull, probably coexisted with a practical one. And the practical one worked. Now let's talk about the people who did all of this. Every human society in history has had a healer, someone whose role within the group was to understand illness and injury and do something about it. These are the world's oldest professionals, older than farmers, older than priests, older than kings. The shaman, the medicine person, the healer, different names across different cultures, but the role is universal, and it is ancient. Archaeological evidence suggests shamanic healing practices existed at least 30,000 years ago. Some researchers believe much older. What did these healers actually know? Far more than we give them credit for. They knew which plants reduced fever, which plants slowed bleeding, which plants numbed pain, which plants caused unconsciousness that could allow a procedure to be performed, which plants cleaned wounds, which plants reduced swelling, which plants caused the gut to purge something harmful. This knowledge was not written down. It was transmitted through direct apprenticeship. The healer trained the next healer, generation by generation. The knowledge accumulated across thousands of years of human observation. We tend to dismiss this knowledge because it was not scientific in the formal sense. No controlled trials, no peer review, no mechanism of action documented. But the plants themselves were real. The effects were real. And modern pharmacology has confirmed, repeatedly, that the specific plants used in ancient traditions often do exactly what those traditions claimed. Willow bark, used for pain and fever across dozens of ancient cultures with no contact with each other, contains salicylates. We call the refined version aspirin. Yarrow, used to stop bleeding since at least the time of the Neanderthals, has documented clotting properties. The poplar compounds detected in Neanderthal dental plaque are chemically close to modern anti-inflammatories. The wormwood plant, used in traditional Chinese medicine for thousands of years, yielded artemisinin, one of the most effective malaria treatments ever discovered. Its discovery in the 1970s won a Nobel Prize in 2015. The opium poppy, detected in the residues of Neolithic vessels from 6,000 years ago in Europe, produces morphine and codeine. Ancient humans were not discovering medicine. They were practicing it, without the theory, but with the knowledge that theory eventually caught up to. Now I want to tell you about something that does not fit the heroic narrative. Being sick was still terrible. Ancient medicine was real, but it was limited. There was no treatment for many infections that are now trivial. A tooth abscess could kill you. Childbirth was dangerous. A wound that got infected could end your life in days. Life expectancy was low, not because ancient humans were stupid or lived dangerously, but because they died from things we have since solved. Infections, parasites, complications from injuries we can now treat surgically in an hour. And here is the harder truth. Most healing in the ancient world was not done by the specialist. It was done by the community. When you got sick in a hunter-gatherer band, the people around you were your healthcare system. They kept you warm. They brought you water. They found the plants they knew could help. They sat with you through the fever. They held you. Researchers who study mortality rates in hunter-gatherer societies have found something striking. Serious illness almost always required sustained care to survive. A person who got sick and was left alone almost always died. A person who got sick and was cared for by their community survived at dramatically higher rates. The oldest medicine was not a plant or a procedure. It was other people. It was the decision made by the group, in a world where every person was a productive member essential to collective survival, to take someone who could not contribute and devote resources to keeping them alive. That decision was not obvious. It was not inevitable. It was a choice. And ancient humans made that choice consistently for hundreds of thousands of years. The evidence is in the bones. Archaeologists regularly find skeletal remains that show evidence of healed injuries and long-term conditions that would have required sustained care to survive. A person with a severe leg fracture who survived for years after the break. A person with severe arthritis who lived to old age in a physical world that should have killed them. A person missing a limb who lived for years in a jungle without modern prosthetics. These people did not survive alone. Someone took care of them. And in a world with no doctors, no hospitals, no pharmaceuticals, that care was medicine. So here is what I want you to take from this. When you feel that signal, the tightening throat, the heavy eyes, the body telling you something is wrong, you reach for 1,000 years of accumulated knowledge. The willow bark knowledge, and the yarrow knowledge, and the penicillin knowledge, and the surgical knowledge, all refined and written down and tested and available to you in ways that would have seemed miraculous to almost every human who ever lived. But the first time a human being felt that signal and chose to do something about it, chose to find a plant, or sat with a suffering person, or picked up a tool and did something difficult and terrifying to try to fix what was broken inside another human, that was the beginning of all of it. That impulse did not require germ theory. It did not require a medical school. It did not require a degree or a prescription pad or a hospital. It required only the recognition that someone was suffering, and the decision to try to help. That is not a modern idea. That is the oldest idea we have.